Welcome to my YouTube channel. Today's video, we shall be looking at the anatomy of the sciatic nerve. The sciatic nerve is one of those vital nerves in the human body. It is the thickest nerve in the human body, or the largest nerve in the human body. So let's journey together so that we'll discuss everything concerning the sciatic nerve. If you are coming across to my channel at the first time, endeavor to subscribe so that you get notification when I upload video on human anatomy. Now let's proceed. This diagram here shows us the distribution of the sciatic nerve. Now let's start with the introduction. The first is the introduction. What is sciatic nerve? Sciatic nerve is the thickest nerve in the human body. It is known as, or regarded as, the principal nerve in the posterior compartment of the thigh, or the back of the thigh, which can be also called the flexor compartment. You get? So that is the introduction of the sciatic nerve. It is the thickest nerve in the human body, which is regarded as the principal nerve of the posterior compartment of the thigh, which is called the back of the thigh, because that is where it mostly innervates or give a motor innervations to those musculatures that forms the posterior compartment of the thigh, which is known as the hamstring muscles. Now, that is the introduction. The next we shall be looking at is the root value. The root value What are the root value of the sciatic nerve? The sciatic nerve is being formed by the ventral rami of the lower two lumbar spinal nerve and the first three sacral spinal nerve, which include from the L4 to L5 and S1 to S3. So this is the root value of the sciatic nerve. The lower two lumbar spinal nerve and the first three sacral spinal nerve. That is what that forms the root value of the sciatic nerve. As you can see here, we have the L4, L5, S1, S2, and S3. So these are the root value of the sciatic nerve. Recall that the sciatic nerve arises from the lumbosacral plexus. You get? That is the union of the plexus between the lumbar plexus and the sacral plexus. They are joined together to form the lumbosacral plexus, which give rise to the what? The sciatic nerve. You get? So this is the root value. The next we shall be discussing is the formation. The formation. What is the nerve formation of the sciatic nerve? The sciatic nerve is being formed by the ventral rami of the lower two lumbar spinal nerve and the first three sacral spinal nerve. That is the formation of the what? Of the sciatic nerve. Now let's write. Being formed by the ventral rami of lower two L4 to L5, lower two lumbar nerve and the first three sacral spinal nerve. So these are the formation of the sciatic nerve. It is being formed by the union of the ventral rami of the lower two lumbar nerve and the first three sacral spinal nerve. You get. So these are the formation of the what? Of the sciatic nerve. Now the next thing we shall be discussing is the origin of the sciatic nerve. The origin. The origin of sciatic nerve. Where does the sciatic nerve originate? The sciatic nerve originates from the lumbosacral plexus, which have the root value of the L4 to L5, which is the lumbar spinal segment, and the S1 to S3, which is the what? The sacral spinal segment. So that is the origin of the sciatic nerve. It originates from the lumbosacral plexus. And the next we shall be discussing is the origin of the lumbosacral plexus. The next we shall be discussing is the what? The cause. That is the distribution of the sciatic nerve. Okay? The cause of the sciatic nerve. How does the sciatic nerve runs from the pelvic region and the gluteal region to the back of the thigh, and also how it terminates into two terminal branches, which supplies to the muscles of the leg and the foot, and also give a sensory innervation to the skin of the leg and the foot. So let's dive into the cause. Now, first of all, the sciatic nerve exits the pelvis. It exits the pelvis. Recall that it is in the pelvis that it forms this root value. You get the root. So it exits the pelvis by passing through the greater sciatic foramen. It exits the pelvis by passing through the greater sciatic foramen below the piriformis muscle to enter the gluteal region. That is the first course it took in the pelvic region. You get. So it exits the pelvis by passing through the greater sciatic foramen below the piriformis muscle to enter the gluteal region. Now, this is the piriformis muscle. This is the piriformis muscle because it pierces the piriformis muscle to enter the what? The gluteal region. You get, because it exits the pelvis by passing through the greater sciatic foramen below the piriformis muscle to enter the gluteal region. You get. Now, in the gluteal region, it travels and descends between the greater trochanter and the ischial tuberosity at the back of the thigh. That is when it has entered the gluteal region. In the gluteal region, it descends and travels between the greater trochanter and the ischial tuberosity at the back of the thigh. That is what it does. You get. Now, at the back of the thigh, the sciatic nerve gives some motor innervations. It gives some motor innervation. You get. Now, as the sciatic nerve crosses at the back of the thigh, which is the posterior compartment of the thigh, it supplies to the hamstring muscle. The first muscle it supplies is the semitendinosus. Here. So it gives a motor branch which supplies to the semitendinosus, which is called the nerve to semitendinosus. It also gives a motor branch which supplies to semimembranosus. These are motor branches. It also gives a branch which supplies to the long head of the biceps femoris. It also gives a branch, a motor branch, which supplies to the adductor magnus, which is the hamstring part. Here is it. Adductor magnus. Now, it also gives a motor branch, you get, which supplies to the short head of the bicep. Recall that all the muscles of the posterior compartment of the thigh are innervated by the sciatic nerve through its two terminal branches. The tibia component of the sciatic nerve innervates to these muscles, you get, while the common peroneal component of the sciatic nerve innervates the short head of the bicep. That means there are two nerves that form the sciatic nerve. We have the tibia component and the common peroneal component. That is the tibia nerve and the common peroneal nerve. Now, see it here. This is the tibia nerve, the tibia component, and here is the common peroneal component. It is two of them that unite to form the sciatic nerve. Okay, the tibia component of the sciatic nerve innervates to the hamstring muscles. Now, the common peroneal component of the sciatic nerve innervates to the short head of the bicep. That is an important clarification. Recall that the sciatic nerve is still traveling at the back of the thigh. You get, because as it descends into the gluteal region, you get, it travels and descends between the greater trochanter and the ischial tuberosity at the back of the thigh. Now, just little above the popliteal fossa, that is at the junction between the middle and the lower third of the thigh, it bifurcates or it terminates by dividing into two terminal branches. You get, that means the sciatic nerve terminates just little above the popliteal fossa, which is at the junction between the middle and the lower third of the thigh, where it bifurcates into two terminal branches to form the tibial nerve and the common peroneal nerve. The tibial nerve and common peroneal nerve. So these are the two terminal branches of the sciatic what? The sciatic nerve. So that is how it does what? It is being fashioned. Now we shall be discussing the distributions of the sciatic nerve. The distribution. The distribution of the sciatic nerve. Number one is that the motor branches of the undivided trunks of the sciatic nerve innervate to the muscles at the posterior compartment of the thigh or at the back of the thigh, which extend the hip and flexes the knee. That is the number one distribution of the what? Of the sciatic nerve. The number two is that the motor branches from the tibial nerve innervate the muscles of the leg, which flexes the leg, and also innervate the muscles of the foot, which plantar flex the what? The foot. That is the second innervation of the sciatic nerve through the motor branches from the tibial nerve. The third one, the third innervation is that the motor branches from the common peroneal nerve innervate the muscles of the leg, which dorsiflex the foot. The motor branches from the common peroneal nerve innervate the muscles of the what? Of the leg, which dorsiflex the foot. You get? So all these three distribution are from the motor branches. You get? So the motor branches, let's discuss the sensory branch. The sensory branches. The number one sensory branch is that the sensory branch from the tibial nerve innervate to the skin at the calf, the skin that covers the calf, and also the medial and lateral side of the heel, the lateral aspect of the foot, and the whole sole. You get? That is from the sensory branch. You get? Sensory branch of the tibial nerve. Now, the number two sensory branch from the common peroneal nerve is that the sensory branch from the common peroneal nerve, what does it do? It innervates the skin at the anterolateral and the lateral side of the leg, the whole dorsum of the foot, except some area which is being innervated by the deep peroneal nerve. Get? So those are the motor and sensory distribution of the sciatic nerve on how it innervates to those structures of the leg and the foot. Okay? So that is how it does what? It works. What we shall be looking on to is the clinical relevance. Get? But before I dive into that, let me discuss the termination properly. The termination. The termination. Where does the sciatic nerve terminate? The sciatic nerve terminates just little above the popliteal fossa, at the junction of the middle and the lower third of the thigh, where it bifurcates into two terminal branches to form the tibial nerve and the common peroneal nerve. That is the termination. The next is the clinical relevance. The clinical relevance. The clinical relevance. Now let's discuss the clinical relevance. What are the clinical relevance that is associated with the sciatic nerve? Number one is the injury to the sciatic nerve. One is injury of sciatic nerve. Now, what are those occurrences that can lead to the injury to the sciatic nerve? Number one is the fracture of the hip bone, a penetrating wound, total hip replacement surgery, posterior dislocation of the hip joint, and also injection to the gluteal region or misplaced injection of the gluteal region. Those are the events that can lead to the damage of the sciatic nerve. We call injury to the sciatic nerve. And when there is an injury to the sciatic nerve, there will be loss of motor function of the sciatic nerve. You get? Because there will be paralysis of the hamstring muscle, which are those muscles that forms the posterior compartment of the thigh or at the back of the thigh, which will lead to loss of extension of the hip and flexion of the knee. Another event that could be implicated as a result of injury to the sciatic nerve is there will be loss of movement at the leg and the foot, because there will be a paralysis of the muscles that forms the leg and the what? And the foot. You get? And also sensory innervation. There will be loss of sensory innervation in the leg and the foot. We have to recall that it is not only sciatic nerve that innervates the whole lower limb. There are also components of other nerves, such as the saphenous nerves. You get? So the number two is sciatic nerve neuropathy. Sciatic nerve neuropathy. Now, you have to understand that as the sciatic nerve is causing in the pelvis, you get, recall that it leaves the pelvis by passing through the greater sciatic foramen below the piriformis muscle. Now, once it pierces the piriformis muscle, you get, it could be a site of sciatic nerve entrapment. The sciatic nerve could be entrapped at the piriformis muscle, you get, which will implicate what? Piriformis syndrome, you get. So that is what we call the sciatic nerve neuropathy. There could be a rising symptom of that because the sciatic nerve will be entrapped in the piriformis muscle because it causes along the piriformis muscle. It passes between the piriformis muscle as it's trying to descend into the back of the thigh. Okay. The next is piriformis syndrome. Piriformis syndrome. Why is that piriformis syndrome? Because the sciatic nerve passes between the piriformis muscle. When it is being entrapped, it could implicate what? Piriformis syndrome. The next is the sciatica. The sciatica. Sciatica or foot drop. You have to understand that when there's paralysis of the sciatic nerve, it could lead to sciatica, which is foot drop. You get, the person will be walking like this. It will implicate a certain gait. The person will be walking like this. You get, so injury to the sciatic nerve or paralysis of the sciatic nerve implicates sciatica, which can become the foot drop. I believe we have discussed the anatomy of the sciatic nerve, ranging from the introduction, the clinical relevance. Thank you so much for staying to the end of this class. I appreciate so much. And remember to subscribe. Thank you so much.